Hello, everyone. When we made the difficult but responsible decision to close our campuses in March, our two top priorities were protecting the health and safety of the Valencia community and our surrounding community and families, and ensuring the continuity of our students' learning. I appreciate each and every one of you for rising to meet the many challenges this pandemic has brought to our campuses. With a lot of hard work, dedication, patience, and fortitude, we quickly and successfully shifted more than 4,000 course sections online in less than 2 weeks, along with tutoring, advising, financial aid, business services, and nearly every other operation at the college, all while preserving our unwavering focus on student learning and success. I can't thank you enough for all you do for the Valencia community. Since we suspended on-campus activities, the senior leadership team has met often, virtually of course, to review new information from local, state, and federal leaders, as well as feedback from our employees and students. As a result, 4 interdisciplinary task forces were created to develop detailed plans that informed the creation of our roadmap for reopening, a 4-phased approach for gradually restoring on-campus activities. Since March, we've been operating in Phase 1, with the college closure, transition to online course offerings, and the requirement of masks, gloves, temperature checks, and a number of other safety protocols for the limited number of employees or students who needed to access the campuses. And based on the best information we have today, and with the partnership and guidance of Orlando Health, we intend to move to Phase 2 of our plan on August 1st and remain in Phase 2 through the remainder of 2020. Under Phase 2, the majority of students and employees will continue to work, teach, and learn remotely. Most of our fall 2020 courses will be offered in an online modality, reserving face-to-face and mixed-mode sections for courses that are unable to be delivered online. On-campus instruction will use modified meeting formats to reduce the number of individuals gathering together at the same time and will allow for physical distancing. Employees working remotely will have limited access to campus facilities for portions of their work that cannot be completed from home. Employees already working on campus to support security, safety, and preparedness of the college facilities will continue their on-site work. This learning-centered approach will also allow Valencia to continue to focus on developing high-quality learning experiences for courses that can be delivered online and prioritize facility use for courses that otherwise could not be offered. Even though we're announcing our intention to move to Phase 2 on August 1st, doing so is based on meeting certain criteria, such as key businesses being open throughout the region, stay-at-home orders being no longer in effect, and testing for the virus being widely available. Most importantly, we must feel confident that we can provide a safe and healthy environment on our campuses, and that you feel safe and ready to return to campus. Throughout this process, we've been in close consultation with Orlando Health to ensure our plans meet or exceed current public health recommendations and best practices. At this time, I'd like to introduce Dr. Plumley, who is the Director of Pediatric Trauma and Chief Quality Officer at Orlando Health, and who has been an integral part of our planning process.
Valencia has taken a careful, measured approach to bringing students and employees back to its campuses with a focus on protecting their health and safety. We've been pleased to work with the college's task forces responsible for creating the roadmap to reopening and have provided our guidance as these plans have been developed. After a thorough review, Orlando Health's Business Ready Task Force believes Valencia's comprehensive plan will help keep employees, students, and visitors safe. We are confident that if the plan is followed, the risk of contracting the coronavirus on campus will be minimized. We believe the college's illness reporting and contact tracing protocols will be effective in isolating any positive cases if they occur and preventing further transmission of the virus. Valencia's leaders will continue to monitor local health conditions and follow guidance issued by Orlando Health, the Centers for Disease Control and Prevention, as well as our state health authorities. We appreciate that while Valencia is moving to Phase 2, you are prepared to reinstate the remote learning and working environment of Phase 1 if necessary. Protecting ourselves from the coronavirus is everyone's responsibility. The Valencia community will need to remain vigilant about hand washing, refraining from touching faces, wearing face masks when physical distancing isn't possible, and immediately reporting any symptoms or contact with someone who has or may have COVID-19. By taking care of yourselves, you can take care of each other and have a successful, fulfilling, and healthy academic year.
Thank you, Dr. Plumley. During Phase 1, we've been taking daily temperatures for employees and students who are on site and in our learning environments. In Phase 2, we will transition to daily self-screening for all employees, students and visitors as well, coupled with training on how to conduct a self-screening for COVID-related symptoms. Anyone with symptoms will be asked to stay home and seek medical care. In Phase 2, and consistent with Orlando Health recommendations, we have added requirements to wear masks covering your nose and mouth in settings where physical distancing is not possible. We continue to consult with our Orlando Health partners throughout this phased process of restoring on-campus activities. Valencia is taking a careful, measured, and responsible approach to resuming on-campus activities. By announcing plans for Phase 2, we hope to give you as much advance notice as possible to plan for the fall term. By keeping most of our courses online, we'll be able to minimize any significant academic disruptions if we have to move back to Phase 1. And over the next several weeks, we will release additional details of what you can expect and what we expect of you. As the full impact of COVID-19 is still unknown, our phased plan is being created with flexibility to enable us to respond quickly to changing public health conditions. Our goal is to be completely transparent about our decision-making processes as we transition through the phases of the plan. So I encourage you to stay connected, engaged, and attentive to the information coming from the college. We hope these plans will help you and ask that you remain steadfast in taking good care of yourselves and your families as well as the college as we continue to navigate these uncharted waters together.